Hey guys, welcome back to my channel. So today I wanted to talk about my ED and my ICU rotation. If you guys don't know, I am in my final semester of nursing school, which means that I am learning about critical care patients. So in my clinicals, we are actually alternating between the emergency department, ICU, which is the intensive care unit, CVICU, which is the cardiac intensive care unit, and then dialysis. So far I have already done my ED rotation and I just finished my ICU rotation this week. And I have been talking about it on Instagram, posting pictures about it on Instagram, and a lot of you guys have been like, girl, we want to know how your rotation went, and you guys want to know, what I did, what I saw, how I feel about it, and stuff like that. So that is what this video is going to be all about. I don't know if I'm going to make a video about dialysis and the CVICU. I'm not really sure. Let me know if you guys want to see that, but I feel like dialysis isn't really that interesting. We were supposed to be, I think, on the oncology floor, but they didn't allow students, like there was only one student that could be sent to oncology at a time, and we're kind of doing rotations with 2 students going to each different floor. It just the schedules didn't work out, so they stuck us in dialysis for 3 weeks. It's been a very unique experience compared to how my other semesters have been. So I feel like this was something that was going to be really interesting because I had no idea what to expect before going into the ED and going into the ICU, and we're gonna be talking all about it. So, alrighty guys, so I had no idea what to expect before going into the emergency department. I feel like you can't really expect much because you really have no idea what's gonna walk into the door when you come in every single day. I don't even know. I didn't really know what to expect. But before going into the ED, I definitely watched a bunch of videos on my skills on how to draw blood and how to start IVs, because if you guys didn't know, I had not started an IV prior to this semester. I just hadn't had an opportunity, and then the one time that I did have an opportunity, I was so scared and I let my nerves get the best of me, which I've told you guys about this before. Don't be that person, by the way. And I didn't start it, and then after that I just regretted it because I had not had an opportunity to start an IV. So little background on the ED. So our ED that we were at for the hospital, there's different sections of the emergency department. Obviously you have patients that walk in and they're sitting in the waiting room to be seen. You have patients that come in on an ambulance on stretchers. So they kind of separate patients depending on how they come in. So the patients that come in on stretchers and cannot ambulate or they can't walk, there's a completely different section for that. And then there's also a different section for patients that do come in walking. So that's kind of how the 2 sections are. And then the other section is for patients that are waiting to be admitted into the hospital. So they're waiting to find a room for them upstairs. So let's talk about the patients that come in waiting in the ED and they walk in, because that was what my first experience, my first clinical day was like. So whenever patients come in, they go into the waiting room and they're waiting to be seen. So when they're called in, they go into what's called an assessment room. So this room is strictly like very plain. There's like a very small bed. It's a very small room, and the only purpose for that room is to be assessed by a doctor and a nurse. So every single time that patient comes in, they go into that room, and then the doctor always comes in with the nurse to assess the patient and see what's going on. Once the doctor has decided, what's going on and what they want done to see what is the cause of whatever the issue is that they're coming in for, so they move them from the assessment room over to the procedures room. It's kind of like a holding area for whatever the doctor has ordered. So if the doctor wants labs to be ordered, that nurse will take out labs, or they'll start an IV if they want fluids or medications given, anything like that. And then that nurse will also take them over to the procedures to get their CT, X-ray, whatever needs to be done. So if the patient is getting an exam done or a test done, that nurse is going to take them over to wherever, the area where they have those tests done, and then they'll call them whenever those tests are done, and the nurse will come over and take them and place them back into that procedures room. And then after this is kind of, I'm sorry if this is really confusing. I was really, really confused my first day because I'm like, what is going on? There's just so much going on. So after they've had those tests done and they're just waiting for tests, or they've had blood taken and they're waiting for those labs, they actually move them to, so there's the waiting room, and what they've actually done is they've split the waiting room in half. They've kind of put this kind of like a flexi wall up, splitting the waiting room. So these are the people waiting to be seen. And then on this side is actually where they take the patients that are just waiting for lab results or test results. So the nurse will actually put them over in this room, and there'll be a bunch of patients, whoever is waiting for lab results or they're waiting for test results. That's actually where they put them. So these patients who have already had their IVs done, they're on fluids, they literally will take the patient on fluids and they'll put them in these really nice comfortable seats where they recline, or they're just regular chairs. It depends at what time you get there. If it's really full, half the people are gonna be on the comfortable chairs and half the people are just on regular waiting room chairs. So that is how that section of the ED is. The people that come into the ED for some results and then they're put in the waiting area waiting for the results. Don't worry, they're not just put in a waiting area where there's nobody monitoring them. So they'll either have a paramedic or a nurse out there actually monitoring all of these patients that are in the waiting area after they've already been assessed. Okay, so that's that section of the ED. If after the results come back and the doctor wants to admit them in the hospital, or if they've decided that the patient needs to be monitored a little bit more critically, they'll actually move them to this other section of the ED. I feel like this is so confusing. They'll actually move them over to this other section of the ED, and that's where there's a nurse, kind of like a med-surg floor, or a regular floor, I shouldn't say med-surg, a regular floor, and there'll be about a 3 patient to 1 nurse ratio, and those are gonna be the patients that need to be monitored a little bit more strictly, so they don't wanna just stick them in a waiting room or in a lobby area where there's like 10 patients to 1 nurse, just because they're waiting for lab results. So this is a section where the patients are a little bit more critically ill, and they need to have more one-on-one ratio with the nurse, or 3 to 1 ratio with the nurse. And then there's another section of the ED of patients that come in on stretchers and brought in by the ambulance, and those are people that are very, very critically ill, and usually there's also 1 to 2 nurses monitoring them. Those are patients that cannot walk on their own. Like when I was over on that section, there was a patient with AFib. There was another patient that came in for a fall, and he had like a gush, an open gush on his head, and a doctor actually sewed that shut right there in the room. So these are gonna be bigger rooms where they have a lot more space if something were to go wrong, or if they need to perform surgery or whatever's going on, but these are gonna be the patients on stretchers. So as you can see, there's a lot going on in the emergency department. I had no idea this is how they kind of split things up. I've personally never been to an emergency room, so I didn't really know how it works, but that's how it worked. There's these patients that are walking over here, patients that are walking but are a little bit more critically ill, and then patients that come in on stretchers and are monitored a little bit more strictly by nurses. So that's kind of how the ED works. Now that I've kind of explained how the ED works, which took me, let's see now, 10 minutes to explain, I can tell you guys a little bit more about my experience. So I actually spent time in all 3 sections. I spent time on the patients that walk in, they're assessed, have some procedures done, and they're put into that waiting area for labs. I've been in the section where we're monitoring these more critically ill patients that are waiting to get sent into the hospital to have a room. And then I've also been in the section over here of these patients that come in on stretchers with more serious issues and need to be monitored a little bit more strictly as well. So I can tell you that the section over here, I'm sorry if it's kind of confusing, I'm trying to stay in the same area so you guys can kind of understand which area I'm talking about. But the section where we're waiting for patients to be sent upstairs, that just honestly reminded me of a regular floor, just because you have that 3-4 to 1 ratio, patient to nurse ratio, and it's kind of just, you're giving them meds, you're giving them, they're kind of like your patients. You do the head to toe assessments. There's nothing really special going on here. They're pretty stable. That's the reason why they're over here. They're gonna be pretty stable patients, and you're just kind of monitoring them like you would on a regular floor. So this section over here of the patients waiting to get admitted, I really didn't feel anything different than being on a regular med-surg floor, which when I was over here, we had a patient with a suspected PE. We had a patient with seizures going on and she just needed to be monitored. We had a patient that came in for nausea, vomiting, and just really, really basic stuff like that. The section over here where patients came in on stretchers, that was actually a little bit more interesting because you got to see the more acutely ill patients. So like I told you guys, when I was over here, there was a patient on AFib. So we were watching how they were trying to convert her to normal sinus rhythm and how they were monitoring her, giving her medications and stuff like that. They had taken her to get some tests done, and that was kind of cool to see, especially because we were learning about cardiac at the time. So that was really interesting to see. And the nurses were really, really nice over here. So that was one of the patients. The other patient that I saw over here was a patient that came in. So it was a man probably about in his 30s or 40s. And his parents brought him in because they found him unconscious on the floor with this huge cut on his head. It was probably like this big. They suspected that he had alcohol in his system, but actually the lab showed, they drew blood, and the lab showed that he did not have any alcohol in his system. So it was probably more drugs that were in his system, because this man was completely knocked out. Like, you could not wake him up. He was snoring. He had this huge cut, and it was a pretty deep cut right on his head that was just bleeding. There was blood all over his face and on his arm, and he was just completely knocked out. And a doctor actually came in, and we asked if we can watch, because he was going to sew that cut shut. He was going to sew it oh my god, why can I not talk? So the doctor actually came into that same room and just sewed that cut shut. I don't know why it's so hard to say. And we got to see that. Me and the classmate that was with me actually got to see that. They didn't give him any sedatives because this man was already knocked out. Like, he was snoring. The doctor kind of put in some anesthesia right here around the cut, and he sewed him, put some stitches in. I think it was about 7 or 8 stitches, and the man was just snoring away. Every once in a while he would be like, oh, he would kind of grimace, but he would not wake up. Like, they just sewed this, so he must have been on some drugs. I don't know exactly what, but he was just snoring away while the doctor came and sewed this shut. So those were the patients that came in on the stretchers. Now over here, this is what they call the jet, which is the waiting area where the patients are just constantly being moved in and out. Each room has a specific purpose. Like I told you, they have the assessment room, the procedures room, and then they have the waiting area where they wait for results. So that was my favorite area in ED because I had so much fun. So this is kind of more of what I expected from the ED, which was kind of more constant pace, doing a lot of stuff. So I was actually paired with the procedures nurse, so not with the nurse that assesses, but with the nurse that starts IVs, gives fluids, gives medications, takes these patients to the procedures room, and takes them out to the waiting area to wait for their results. So this was definitely my favorite because every 5-10 minutes we had a new patient in each room. So it was just a constant rotation of trying to get patients in and out, in and out, in and out, in and out, to best assess everybody and to best serve everybody, because the emergency department kind of gets really, really packed. So that's the best way that they have found to try to help these patients get in and out, try to get assessed, and just wait for lab results. And then that's when they send them back to that kind of flexi-wall waiting area where they have a paramedic watching them. While I was in the ED, I got to do probably like 6 or 7 IVs. I got to do so many blood draws, which is with a little butterfly clip where they don't actually need an IV, they just need labs for test results. So I got to see that. The thing about that is that you have the patient for a very short amount of time, so you don't really get to know much about them. The only thing you really get to know is what the doctors are suspecting and the nurses are suspecting, what is wrong with the patient, and you just do whatever is ordered. So if the patient needs an IV started, you start the IV. Patient needs medications, you give them the medications. Patient needs to be taken to the procedures room, you take them there. So that's kind of what that nurse does. It's just a constant rotation of patients. So we probably saw about 20 patients a day that day that I was there, and it was really hectic. So every single time we went into a patient room, she just had me grab the IV cart, and she just had me starting IVs all day. I actually hadn't even started an IV until I got to the emergency department, and the nurse that I had was amazing. She helped redirect me the first time to the best way of putting my hand placement and holding the needle and giving me tips and tricks and telling me, you know, this is what you're doing really good. You know, if you did this, you know, you could probably do a little bit better, blah, blah, blah. So she just gave me so much practice. She made me feel so comfortable. So I was just continuously starting IVs, which is super freaking cool because the first one, I was shaking so bad. I was so nervous. The thing that made me the most nervous about being a nurse was starting IVs, and now I think they're so much fun. Like, it's kind of exciting going in like, ooh, what is this patient gonna have? Are they gonna have small veins? Am I gonna be able to get it? Blah, blah, blah. So it's really, really fun to start IVs now for me, but before that I was really nervous. The ED was just amazing to do blood draws and to do IVs. I had so much fun there. And then the only thing about the ED is, like I said, you don't do a lot of patient care and you don't know a lot about the patient, so it's a very short amount of time that you spend with them. But while you're there, of course, you need to know when a patient is declining and what to do if a patient is declining, because we still don't even know what's going on with this patient. It's just very broad signs and symptoms and that's what the patient's going to tell you. So you don't really know what's going on. So you have very short snippets on what exactly is going on. So that was my experience in the ED. I loved the ED. My review of the ED is I would love to be an ED nurse, just because I feel like you can get really, really good skills. You get to see a little bit of everything. You never know what's gonna walk in the door. Sometimes you just have patients coming in for the fluid. You're like, okay, why are you here? And then you have patients that come in with cuts or, you know, gunshot wounds, or just so many different things that you get to see, which is really cool. So, and that was my experience in the emergency department. The thing that was really cool about the ED too is that you have nurses, patient care techs, and doctors that are there all of the time. So you need anything for a patient, you literally walk down the hall. Doctors all have their own little room. So that was really, really cool to see, because you just have everybody there, and those doctors were just so freaking nice. Like, you could tell those are doctors that prefer to be more personal with you, because they're so nice. They love to talk to you. Like, you know, I got to see a doctor stitch up a patient, and he's like, do you guys have any questions? If you guys have any questions, you know, feel free to ask me. And it just like made you feel really comfortable. So that was really cool to see. Now, the ICU. ICU was really interesting as well. So I was in the ICU for 3 weeks. My first day of the ICU, I can tell you straight up that I came home with the biggest headache I have probably had since my first day of clinical ever. So a little background on the ICU. If you've never been in the ICU, you don't really know. It's a 2-to-1 patient to nurse ratio. So each nurse has about 2 patients. Everybody in the ICU, almost about everybody in the ICU, is on a mechanical ventilator. So a lot of them are sedated. So a lot of the time what you're really taking care of isn't really the patient themselves, because they are sedated. You're just managing machines and you're monitoring their status. A nurse actually told me that her job is just to keep patients alive, because the ICU is very intensive and these are very, very critically ill patients. So they're not very stable. I asked my nurse if they get codes very often. She's like, we probably get codes about once a week. So that's an area where you just need to be on high alert literally all the time. You can walk into the patient room and 1 second later they can be coding. So it's just, you need to have very detailed information. You need to know every single detail about this patient to know what could be going on and what could go wrong, so you can monitor for that. So that was really the difference between the ED and the ICU, is that the ED, you barely know anything about this patient, and it's just quick, in and out, in and out, in and out. You don't know a lot. ICU, you need to know absolutely everything. You really need to know these disease processes. You really need to know these machines. You really need to know what to look for, monitoring those vitals, knowing everything about their medications and stuff like that. So that was the difference. Another thing about the ICU is that you have RTs on the floor literally all the time, because obviously these patients are on mechanical ventilators, so you're gonna have a respiratory therapist there all the time. Since it is a 2-to-1 patient to nurse ratio, you need to have a lot of knowledge and you need to just be on constant high alert. While I was in the ICU, I actually got to see 2 patients get intubated. So it's very quick. There's doctors just there all the time, and these nurses just know when these patients are not gonna, when they're kind of starting to code or they're declining, and they let the doctors know, and the doctors would just intubate them right there. So it's really interesting to see that, because you got to see how the respiratory therapist, the doctors there, and the nurses there, and how they all work together to intubate these patients. So it's all very quick and very it's just very quick, and there's a lot of teamwork that really goes on, and it's really cool to see, because in the ICU, doctors really trust their nurses, because ICU nurses, like I told you guys, you need to know a lot to be an ICU nurse, because you're constantly monitoring these patients. So these doctors really trust these nurses. So it was really cool to see, because nurses would ask the doctor, you know, how much of this medication do you want me to give? And he's like, well, you decide that. What do you think this patient needs? So then the doctor kind of gives that to the nurse and allows the nurse to kind of pick how much. Like they were intubating this patient, and this patient wasn't completely sedated while they were inserting the tube, and you know, you need the patient to be completely paralyzed. So the doctor ordered some more of the medication, and the nurse asked, how much more do you want me to give? The doctor's like, whatever we need to get this patient completely knocked out, because she cannot be moving while she has a tube in. So that was something that was really cool to see. The only thing is that it is not my favorite. You're really monitoring machines rather than patients, because you really don't get to talk to a lot of these patients. Sometimes you will have a patient on a mechanical ventilator that's just wide awake and sitting up in bed. My first day in the ICU, there was this lady that was completely on a mechanical ventilator, and she had a little notepad, and to communicate she would just write things down and like show you what she wanted or what she wanted to say, which was really crazy. When I walked back her room, I'm like, wait, what? And that was actually one of my patients. That was a really interesting case. But yeah, so a lot of the time you get to see patients that are more in like septic shock, that are in respiratory distress, that patients that had seizures, patients on trachs. You get to see so many trachs. I also got to see a patient get a tracheostomy, which was a tracheotomy. I keep saying ostomy, a tracheotomy, which was really cool. ICU, definitely not my favorite. I just don't like the fact that you don't get to talk a lot to the patient. I don't really feel like I had a patient. I still talk to the patient even though they were sedated, because they can still hear you, they can still feel you, like they can still squeeze your hands. They're just sedated because obviously they have a vent, a tube down their throat breathing for them, so they cannot talk and be awake. But yeah, the ICU really is not my favorite. It's just very stressful. I felt like I had to think so freaking hard, because I'd walk in and I'm like, okay, this patient came in with respiratory acidosis, now they're respiratory alkalosis. How is this machine gonna get them out of respiratory alkalosis? Why are they labs like this? Wait, if the labs are like this, what do we need to change the machine to? Wait, why is the machine at this if the patient is doing this? And it's just like a constant back and forth of trying to put all these dang pieces together. So hats off to my freaking ICU nurses, because you guys are smart as hell. And it's just, I don't know. I like my patient to nurse relationship. I'm the type of person where I'd rather talk to my patients, even though you probably, it's less annoying to not have to talk to them, I guess. It's just, I prefer that interaction, and I prefer having people to care for rather than machines to care for and monitor. So yeah, that was my experience in both the ED and the ICU as a nursing student. I honestly loved ED, and I would love to be an ED nurse just because you get to see so much. But then at the same time, like I told you guys, you don't really get to learn much related to medical illnesses or diseases, because you see very short, tiny little snippets of everything. You don't even know what ends up going on, because once you pass them off, they're off and they're no longer your patient, and you have no idea what happens to them. So that's kind of how it works. But yeah, I really hope you guys enjoyed this video. If you did, make sure you give it a thumbs up. Thank you guys so much for watching, and I'll see you guys in the next video.